Hello, everyone. Welcome back to Pre-Med Radio. My name is Neela Bandla, and I am the host of the show. Today, I am here with Rithika Narravula, who just graduated from the University of Pittsburgh with the major in psychology. How are you doing today, Rithika?
I'm good. How are you?
I'm good. And today we are going to be looking at misinformation in medicine. So, my first question for you is, how has misinformation in medicine changed as technology evolves?
So, technology is a really big part of our lives, especially now. Our biggest outlet for news or just information in general or social media comes from technology. And currently, I think a lot of us use these social media platforms to get most of our information. So if we see an article or a post that was made, a lot of us tend to just kind of quickly just read it and I guess not really fact check information too much. And I'm sure there are people that do fact check their information, but I think for just the general public, I think a lot of us just assume that what we see online is automatically correct. And I think that just quickly reading a small snippet of information could lead to misinformation, whether it wasn't the whole story or the whole truth. So I think that could technology has definitely led that way a lot.
Yeah, absolutely. I think it's all just because we have a more easier way to access information because of technology and the internet and everything. It has become a lot easier to spread misinformation. Um, so I'm going because with misinformation, we look at social media a lot for a lot of our content, as you said. So, what is social media's influence on misinformation spread in the healthcare industry? Also, with the rise of healthcare influencers. So, just to specify, healthcare influencers are maybe like fitness influencers or people who may also be professional healthcare workers, but also work in the social media industry. So, yeah.
Yeah, I think that just social media, so influencers in general, their whole motive is to influence people to buy or kind of consume their media specifically. So most of the time they're reaching for their target audience, and healthcare, I feel like, can kind of benefit a lot of people or pretty much everyone for that matter. So I think that, sometimes people will promote certain supplements to take or certain exercise regimens or eating habits or sleeping habits. And I'm sure that most of the time it's never like something super harmful. Um, but I think that everyone has a different way that how like exercise or diets can benefit them. And I think that just because one person said something, it might kind of lead everyone to go there. Because I know during COVID specifically, there were a lot of people, there was like a whole movement towards trying to be more in shape or eating better, sleeping better, because everyone had all this time. And there were specific influencers that people would follow and reach out to. And then more recently, people are finding out that, oh, this person was not being accurate with their information. So I think for the time being, people will try to influence to consume their media. But I think people should just be aware that what works for one person may not work for everybody. So,
Yeah, absolutely. And I think it's especially been something during the COVID-19 pandemic where there's this rise of, I guess, I know from personal experience, there was a big rise in fitness influencers and
mhm.
health and everything like that because COVID-19 had heightened that topic. So why do you think there was so much misinformation during the COVID-19 pandemic?
I think that, COVID-19 was such a big impact on everybody. And it wasn't like a gradual kind of rise for any type of anything. It just kind of impacted pretty aggressively to everybody. So I think during that time, a lot of people and most people didn't know how to handle it. All of their jobs and routines were interrupted, and there was this kind of maybe confusion, maybe urgency or fear of not knowing when people were going to be able to get back to their normal routines. So I think that as soon as people started kind of posting online or articles came out to do this or don't do that, people were kind of trying to find something that would give them that stability.
Mhm.
So anytime there was something that was put out, people were quick to kind of just follow it or be super against it. And I think that urgency and kind of fear of not knowing what was happening, not knowing if things were going to get better, just kind of put that fear in people. And still to this day, we still see a lot of the stuff happening. So I think a lot of information can be wrongly spread if there was, a lack of research. And a lot of these people don't have a lot of medical background
Mhm.
either. I mean, it could just be the average person. So, without having that background, I think it's tough to just uh, not follow what people are doing because you wouldn't know
Yeah.
any other way.
Yeah, absolutely. And I think like you hit the nail on the head when people are not really listening to, I guess, not listening, but they are listening, but they tend to also take um a lot of things like that other people have said, like the average people have said that may not have a medical background very seriously. Um so as we know, like misinformation is bad. Like that is something that I think we both agree on. Like misinformation in the healthcare industry is bad. But do you think that people who somewhat promote or somewhat go against it, like do people who kind of, I guess, benefit on the internet by saying these things, do you think that they may truly benefit from spreading misinformation, or could there be a sort of nuance with people spreading this misinformation and like everything like that?
I think it's hard to say just being kind of an outside perspective. It's, um, you can't really make any judgment unless you know the full story. And I think that's why a lot of misinformation gets spread. A lot of emotions are involved. Like, I mean, especially with COVID, also, as we said before, people are, have certain beliefs or opinions on certain things. So if we were to feel really strongly about a piece of information or whatever it may be, we'll look for more stuff that will try to support what we previously believe. And same for vice versa. If you didn't like something, then you're going to try and find something in opposition to that. So I think that it's hard to just narrow it down to like whether one person is like benefiting from like nuances of spreading misinformation. But I think that just keeping in mind that it's hard to just say one thing about one person, and it could benefit them, but I guess it's more up to the people who are consuming that media to make a judgment for themselves.
Yeah, absolutely. And I know that you mentioned emotion, which has been a big part of social media, and I think that's what social media strives off of and how it grows. So, how was mental health impacted by this rise of misinformation, especially during the peak and post of the pandemic that we just recently went through?
Yeah, I think mental health was definitely like one of the biggest things that people had either a hard time trying to navigate, especially during a time that like I'm sure no one's been through probably. Um, Definitely, I think one of the biggest things, and I took a class last year sometime that talked about this, that a lot of people didn't feel really comfortable reaching out and looking for the help that they needed because, they were scared of, judgment from other people, or they didn't have the means to go look for it, or they didn't know how to. So, and I think just, whatever piece of information that they might have had to kind of, take that and then move on from there could have just been not enough. And that might have kind of maybe led them astray a little bit more, even, especially in like such a chaotic and difficult time for people.
Yeah, absolutely. It definitely made just a bunch of like a chaos, I guess. sort of just a mixture of like chaos, and then you didn't know what was true or what wasn't true, and a lot of people became victims of that. Um, so why is it important to understand misinformation in the media and how people are impacted by it?
I think it's definitely important to understand that, just bottom line, that maybe not everything you read is accurate. It might just be a couple extra steps to maybe like ask your healthcare provider, your doctor for some more professional advice. Um, but I think it's definitely just good to know that, the first thing you might read, or even just maybe there might be 10 posts about it or 10 things you might read about the same thing. But if it involves like healthcare, like especially medicine, it's like it, at the end of the day, it's like a life or death thing to some people. And just taking the first thing that you might see could be detrimental to some people. So I think it's very important to just make sure what you're reading and what you're believing and using in your life is, accurate and helpful to you.
Yeah, absolutely. And a lot of it comes onto the individuals themselves to kind of make almost like a stance and make a change in misinformation being spread and pointing it out when it is spread. Um, so how can healthcare become a more educated topic so that we can stop the spread of misinformation within people who may not be going into healthcare, who may not be who may not have the knowledge of healthcare professionals?
I think the most accessible thing for most people, not all, is to just ask your doctor. I mean, that's, I feel like, the most direct form of information that you could get. I mean, if I were to have some sort of issue or concern with my health, the first thing that I would think of is to ask a doctor. And if I wasn't able to go do that, the next thing would be to research it. But I think doing more than just surface level research, staying informed on things that are happening, being up to date with that, as because medicine is continually evolving, and something that might have worked for you maybe in the past, I'm sure it could keep working. People say don't fix what's not broken, but I think it's important to just keep in mind that something else could be better or maybe more effective. Um, so just being more open minded to certain things will probably help and maybe benefit in a more efficient way, if at all. So I think just doing more in depth research or asking people around you that maybe are involved in the medical field or have that healthcare knowledge, verifying with multiple sources. I think anything that could get you the most possible information as opposed to just, one Google search on something.
Yeah, absolutely. I think it is the most direct approach to just ask your doctor, ask a healthcare professional about these things because it truly is something that is very important. And when you have almost this kind of, I guess, politicalization or this rise of making healthcare a topic in the news and everything, it becomes sort of misconstrued.
Mhm.
So, how does journalism and misinformation in the healthcare industry go hand in hand?
So journalism is a very fast-paced field, I would say. I would say that, in my opinion, their primary purpose is to get information and put it out there as fast as possible. As a news outlet, you want to be the first one to convey information to the public, so more people will come to you as their resource of information because you're the one putting out information first. So I think that because of that speed and quickness, and trying to put everything out there as fast as possible, a lot of that information can get lost. Or if things come to light in the future, I think that, because of how quickly we consume media and we are to form opinions, as soon as something comes out and we read it, we kind of make assumptions based on that initial piece of information. So anything that comes out after, I think it's harder to incorporate that into what was initially put out. So I think that because of how quick people or journalists put out information, I think sometimes some of the information might be lost in translation or just something hasn't been put out yet. Um, so I think that might be one of the biggest ways.
Yeah, absolutely. It just, I think that once you put something into someone's head, once you say something that you claim as well, when a journalist claims that's true, it tends to stick in people's heads, and then maybe it'll get disproven in the future, and then that ends up being a lot, it becomes a lot more harder to allow people to be convinced about that. So, how did the politicization and the industrialization of medicine create more misinformation or less misinformation? Why or why not? And I made this question a little bit more US specific, especially since we don't have like public health care, just to add a little bit of context.
Yeah, I think that it can go either way, more or less misinformation. Um, I think people, like I said earlier, form opinions on what happened in the past, and I think people take that and use that information to kind of shape what happens in the future, and then form more ideas or more beliefs or opinions about those things. And I think with more with our current system, I think just how things have been done before will shape how people believe in the future. So I think it just is stays the same. It could be more or less based on, again, emotions and certain affiliations that people might have. If somebody feels really strongly about something, I think they're, even if it might be wrong a little bit, it just feels right for them to keep fighting because that's what they believe in. And same for the other way, for or more misinformation. Some people might say that, sure, yeah, you believe in it, but this isn't fully accurate. But, people will stick to what they believe in.
Yeah, absolutely. And if you could you give like a current day or like a recent day or something that happened recently, like an example of sort of how people have stayed stubborn in their beliefs?
Huh. Um, I can't think of currently, but I just took a class called Morality in Medicine, and we talked about this case, the Tuskegee syphilis study, I believe. And these people, I mean, long story short, these people had syphilis, and when they got their blood tested for more like research purposes, the researchers just kind of told them that they had bad blood instead of telling them what was actually wrong with them. And that type of misinformation is like more direct. And I think that, we had a long conversation about it in class as well, about for research purposes or whatever, um, for stubbornness. And I think that that applies, I guess, in a more recent context as well. For researchers, the goal is to just kind of find treatments and find cures for things. And there's still ongoing studies about that now. And there's always this ongoing debate on how far we can push the boundaries with like research and things like that. And where do we draw the line morally or ethically and stuff. And I think that's where people can be a little stubborn, and both sides, like from the patient side, people can say that, this is too much, we're putting ourselves at harm. And from the researchers, this is how we're going to get more information. So I think that that stubbornness kind of just persists and will continue to persist in that aspect. Um, yeah.
Yeah, absolutely. There's just, I think it's just kind of like also in like human nature. I'm not like making a claim like this is like supported, but I feel like in human nature, from what I've seen, is
Mhm.
that people have this stubborn mentality because it is hard to get out of the ideas that you have been presented with that maybe you have grown up with, or maybe that you have always believed in. So, why does less trust in our systems of health, which means like our healthcare system, the government, and everything, lead to more misinformation being spread? And how could this be preventable?
Yeah, so I think with less trust, a person is less likely to want to believe what is said, even if it may be accurate. And we were just talking about stubbornness as well, and I think this plays a role in it. If we don't like something, no matter how right they are, I think it's just in our nature to kind of fight back anyway,
Mhm.
and say, no, I don't believe that, or no, I just don't want to listen to you. So I think this it works the same way here. If there is information spread about something and we don't particularly like that, organization system or whatever, then we're going to just not want to believe, and whatever we had thought before is just going to persist. And we tell our friends tell their friends, and it's like kind of like a game of telephone. At some point it's just going to get so misconstrued that whatever ends up on the other side is just not what we started out with. um, and ways to prevent it is, like I said, just being more informed, just being more impartial. I think in medicine it's important to understand that impartiality because of the stakes that are at hand. It's people's lives that we're trying to help and make better. So I think that even if we're opposed to something that's not what we used to do, I think it's important to just try and be impartial, keep an open mind to things. So whatever the outcome or whatever the means, I think as long as it's in benefit to you and you believe that it's in benefit to you, I think that it could be a possibility to be more open minded that way.
Yeah, absolutely. And I think it also has to do with just how our system works, especially in the US, because we don't have a public healthcare system, essentially. Well, I mean, we kind of do, we kind of don't. It's
Mhm.
complicated. There's a lot of private-owned industries within healthcare in America compared to other countries and things like that. So, my last question for you is how can healthcare physicians themselves be more informed and help educate others on controversial topics where misinformation is common? And an example is sort of vaccination, because there's some people who have a big pushback against that.
Right. Um, for doctors, I think that because medicine is so continual, there's never just like here we have this, we're just going to use this forever. Medicine changes, and I think we've seen that with COVID-19. I mean, it's something that's impacted everyone so widely, and I don't think, at least just for how quickly it was impacting everyone, people were anticipating it to that scale, I feel. And, doctors, I think because of how quickly medicine changes, it's important to just continue to learn and continue to grow, continue to educate themselves on what is happening, what is to come, and do more research on that. Research is always ongoing, there's research at all times. I think just staying informed with what's going on, potentially what might come. And I think like you said, for vaccination, because there is such a pushback for some people who just really don't want it or believe in it. I think to handle that type of controversy, that you can provide accurate information and just put it out there, and whatever people may want to do with that information is for them to decide. But I think just to handle it in a non-partial manner is to just lay out all the information, say, and like kind of like show them what could be the pros and cons of either side. And I think it's just going to have to be kind of left up to the individual to decide.
Yeah, absolutely. Because I think it almost kind of like at the end of the day, a lot of the people that healthcare physicians see have grown up with these ideas and have like a doubt of these ideas, maybe due to past history or traumas or anything like that. So I think it is very important to kind of keep that kind of compassion in mind, especially when healthcare professionals are working.
Right.
Um, yeah.
Yeah.
Thank you so much for letting me interview you today. This was a wonderful topic.
Thank
Um,
you.
Yeah, so thank you for coming on today.
Thank you for having me.
Of course. Okay.